I feel like COVID is a little bit of a drama queen. I got to be honest, because here's the deal.
Oh,
Everyone's
yeah.
been talking about COVID, and obviously it's a serious situation. You don't want to get it. But that doesn't mean all the other things that could get you sick just stopped. They're still out there trying to get you too. The flu, a huge one this year, and you're hearing so many professionals say you got to get the flu shot. You don't want to get the flu and get COVID this year. That is a bad sign, a bad thing to happen. Our next guest has some flu tips for you.
That's right. He's here with some good signs. He is Dr. Jeffrey Wagner. He's the Chief Medical Officer with P3 Health. Welcome.
Thank you, guys. Uh,
Yeah.
so, like you said, let's talk about flu season. It's coming around. Flu season typically starts October and it can last all the way to March. Flu season is usually in Las Vegas, peaks around January, but can peak much earlier in the year. So it's always important to get going and be on top of it.
Yeah.
We typically see uh, when when uh, when you have the flu is it's a little bit different than what's been dominating the news lately, which is COVID. Flu is
Right.
usually a very abrupt onset of fevers, chills, nausea, vomiting. You get very significant malaise or myalgia, so muscle soreness, muscle aches.
Mhm.
Uh, you usually develop these runny nose. You can become very, very dehydrated very rapidly, and so we always encourage people to make sure they're drinking a lot of water and always let your primary care provider know very rapidly when you start having symptoms.
Mhm.
Yeah, definitely. Thanks for giving us an idea of what we should be looking for. And what should people do if they think they are coming down with the flu? What
Yeah.
is that first step?
So we talk to people about this all day during this season because it's very important. I somewhat mentioned it a little bit earlier, and that is to contact your primary care provider pretty much as soon as you can because flu is very time sensitive on treatment. We have quite a few different medications available to treat the flu, but the mainstay of therapy in flu medications you usually want to start within 48 hours of your onset of symptoms for maximum effectiveness. What will happen is when we give medication to help treat the flu, it will decrease your symptoms. So it will decrease how bad you're feeling, and it'll also usually shorten the duration of the illness. Typical flu, if you don't take any medications, will last usually over or up to over a week, right?
Mhm.
7 to almost even 10 days. Whereas if you get on medication, a lot of times you can cut that number almost in half and have a much less severe case.
How
So
does
it's
Hmm.
Yeah, go ahead.
I'm sorry. So I was going to say, so it's really dependent on getting in quick. The name of the game is when you start feeling those symptoms that I discussed, uh, letting your primary care provider know pretty much immediately.
Yeah, stop trying to
Hmm.
tough it out and say, I'll just take
Yeah,
some NyQuil. I'll be all right. Yeah, yeah. And then a week later, you're like, okay, I feel terrible. So
that's exactly right.
what care initiatives then can we start doing now to maybe just avoid getting the flu in the first place?
Yeah. So, number one, by far and away, and this is pretty much on the topic across the nation, is vaccination immunization. Fortunately, the flu shot we've had a lot more experience with than COVID, and getting the flu shot is something that we can do, and we do every year, and it is strongly recommended. We typically start giving flu shots in September, and you can receive them all the way through March. Uh, the flu shot typically takes about 14 days to give immunity after you receive the vaccination. So
Mhm.
once again, not waiting until December saying, we have to be worried about being sick from December and January for the Christmas holiday, so I'll do it then. Not really a good idea. You want to make sure that you get that shot so your body has time to develop the immunity to the seasonal flu.
Mhm.
Um, it's
That's
this
interesting.
year, yeah, this year more than normal. I can't tell you how strongly I'm recommending the flu shot to my patients. And the reason being is we have COVID. COVID's dominated our lives for now, what, the past 7 months or so.
Yeah.
And so we are doing our best. People are putting in the efforts. They're wearing their masks. They're social distancing. It's changed really the way we're living. Uh, and so this part is we're coming now onto flu season where we haven't had to deal with flu season with COVID yet. And so any extra medical burden that we can avoid is really, really, really being sought after.
Yeah.
So taking the flu shot and actually avoiding the illness is infinitely better than treating the illness and having more and more exposures and transmission of disease that's essentially largely preventable if you vaccinate. So we are incredibly anxious to have people get vaccinated this year in the healthcare community.
Mhm.
Mhm.
Other things you can do besides vaccination, because some people just can't take vaccinations for whatever reason. Other things you can do is we always recommend eating and living a healthy lifestyle, staying, exercising, staying well. In the time of COVID, this has all changed. People are staying indoors a lot. However, getting out
Isn't
for
that
those
the
morning
truth?
walks, yeah, getting out for those morning walks, exercising on a daily basis, staying mobile, staying healthy, staying well, eating the right types of foods, uh, all hugely important. And then the
Doctor, I
last
tell
thing that
you,
we can,
all those points there are just so profound, and never have
yeah,
we ever been so aware of taking care of our health. I'm so sorry we've run
yeah,
out of time, and we want to mention
oh,
P3 before we go. Let us know
absolutely.
how we can get in contact with P3 and what kind of
Okay.
services are there for us.
So P3 Nevada is a medical group that focuses on physician-led, patient-centered care. Uh, you can go ahead and reach out to us at the number that you have provided.
Mhm.
And we have over 9 clinics in the valley. We have 30 primary care physicians slash providers that are ready and willing to see you. We also have a network of over 350 affiliated primary care providers and over 1,000 specialists in town. So we are a large group. We are anxious to try to help you
Yep.
stay well and keep you well. We also have an excellent website at p3nv.org,
Mhm.
which you can get on, and there's a great repository of information, and you can get in contact with us.
Doctor, it's
Dr.
great having
Wegner,
you.
thank you so much for joining us.
Thank you.
All right, p3nv.org or call 702-333-4700. The clinics throughout the valley, and P3 Medical, a proud sponsor of the Morning Blend.